The death of Gloria Ramirez, the toxic woman. On the night of February 19, 1994, Gloria Ramirez, a 31-year-old woman, was admitted to the emergency room at Riverside General Hospital in Riverside, California. She was suffering from late-stage cervical cancer and experiencing severe heart palpitations and difficulty breathing. What happened in the hospital that night would later be known as one of the most bizarre and disturbing medical mysteries in history. Gloria Ramirez became infamous as the toxic woman after several hospital staff members fell seriously ill after coming into contact with her body fluids. The case has remained unsolved, with theories ranging from toxic fumes to chemical reactions, but the exact cause of the strange events remains a mystery to this day. The emergency room incident. When Gloria Ramirez was brought into the emergency room, she was in critical condition. Her heart was beating irregularly, and she was showing signs of confusion and distress. The medical staff quickly tried to stabilize her by administering sedatives and defibrillation to bring her heart rhythm under control. However, things took a bizarre turn when nurses and doctors noticed an unusual oily sheen covering her body, as well as a strange, garlicky odor emanating from her mouth. As the medical team worked to save her, Nurse Susan Kane attempted to draw blood from Ramirez's arm. It was then that things became even more disturbing. When the syringe was withdrawn, an abnormal and foul-smelling odor filled the air. Nurse Kane noticed that the blood contained unusual, manila-colored particles floating inside. Almost immediately, Kane began to feel faint and dizzy, and she passed out. Shortly after, other members of the medical team began to experience similar symptoms, including nausea, dizziness, and even temporary paralysis. Dr. Julie Gorkinski, who was treating Ramirez, collapsed after experiencing severe shortness of breath and muscle spasms. In total, 23 staff members in the emergency room that night reported various symptoms, and 5 of them were hospitalized for their conditions. The emergency room was evacuated as hospital officials declared a mass hazard situation, unsure of what had caused the sudden illness in so many people. Despite the medical team's efforts, Gloria Ramirez died from kidney failure and complications related to her cancer about 45 minutes after arriving at the hospital. But the question remained, what had caused the strange symptoms among the hospital staff? The an extensive investigation was launched to determine what had happened in the emergency room that night. Initial concerns centered around the possibility that Gloria Ramirez's body had emitted toxic fumes or chemicals that had somehow affected the hospital staff. However, no definitive cause could be determined. An autopsy was conducted on Ramirez's body, but it failed to provide any clear answers. The strange oily sheen on her body and the unusual smell were noted, but no toxic chemicals were found in her blood or tissues. The mysterious manila-colored particles observed in her blood were also unexplained. The California Department of Health and Human Services conducted a detailed investigation, and they proposed that the incident might have been caused by mass hysteria or a stress-induced reaction among the hospital staff. However, this explanation was not widely accepted by those who were seriously affected, including Dr. Gorkinski, who had been hospitalized for weeks and suffered long-term health issues as a result of the exposure. A possible theory, DMSO1 theory that emerged in the aftermath of the investigation involved a chemical called dimethyl sulfoxide, DMSO, a substance sometimes used as a home remedy for pain relief. It was hypothesized that Gloria Ramirez may have applied DMSO gel to her skin to alleviate the pain from her cancer. When Ramirez was admitted to the hospital and given oxygen, the theory suggests that the DMSO could have converted into dimethyl sulfone, DMSO2, which is relatively harmless. However, when the medical team used defibrillators on Ramirez, the electrical shock might have caused the DMSO2 to further break down into dimethyl sulfate, DMSO4, a highly toxic chemical that can cause severe symptoms such as respiratory distress and organ damage. This theory offers a potential explanation for the unusual symptoms experienced by the hospital staff, but it remains controversial and has never been conclusively proven. The DMSO theory is supported by the fact that dimethyl sulfate is known to produce toxic fumes, which could account for the dizziness, fainting, and other symptoms that occurred in the emergency room. The legacy of the toxic woman. Despite the various theories, the true cause of the strange events surrounding Gloria Ramirez's death remains a mystery. Her case has been the subject of numerous medical discussions, documentaries, and even fictionalized portrayals, but no definitive explanation has ever been reached. The incident left a lasting impact on the hospital staff who were affected, with some continuing to experience health problems long after the event. Dr. Gorkinski, in particular, suffered from chronic health issues as a result of her exposure and remained vocal in her belief that the event was caused by something more than mere hysteria. Gloria Ramirez's tragic death and the bizarre events surrounding it have made her case one of the most unsettling medical mysteries in modern history, and the question of what truly happened in that emergency room continues to haunt those who were there. This true story of Gloria Ramirez, the toxic woman, is one of the most bizarre and disturbing medical mysteries in recent history. The unexplained symptoms experienced by hospital staff and the strange circumstances of her death make it a haunting and unsettling case that has yet to be fully understood.